feel this is about the best time to, discuss this, popular and well-known disease state affects quite a number of people in the country. So, um, all right. So as we start, our our session is going to go this way. All right. So I'm currently doing the welcome. After which, in the short while, I'll have the pleasure of, welcoming the MD CEO of Oakleaf Pharmaceuticals from Paediatrician to give us a short welcome address. Then after that, we just basically talk about housekeeping rules. I think I can easily discuss that right now. I'll appreciate everybody not, speaking to be muted. If you have any questions, please kindly note them down so that at the end of each presentation, you can, quickly ask your questions. You can either type your question in the chat session or request by raising your hand. So there's a hand raise, button in your controls to raise your hand, and you'll be called to unmute and ask your question. Okay, so after every presentation as well, if you still have further questions, contact will be shared, and you can easily contact us directly to ask whatever questions you have. Okay, so that's essentially how today is going to go. Then after that, I'll have that pleasure of introducing our keynote speaker today to do justice to the webinar topic of today. And then we'll do a short brand presentation as well on our wellness solution that actually benefits the target audience, the target patients for today. Then we'll open the floor for questions shortly, and then we'll have a short closing remark. I will call it a day. So that is how we're going to go today. And without wasting time, I would like to please have the pleasure of welcoming Dipo Adetui, the MD CEO Oakleaf Pharmaceuticals, to give us a short welcome address. Thank you.
Good morning, everyone. It's a pleasure to be here. Thank you very much, Famshay, for that introduction. And I would like to say a big thank you to everyone who has taken time out of their weekend to join us at this important webinar. Like Famshay also said, today is this session marks the second edition of our webinar series, and we tend to be having it every quarter. So we are going to have 2 more before the end of this year. So I'd also like to say a big thank you to Dr. Morufat OGUNDEYI for also accepting our invitation to come and have this discussion on sickle cell. And of course, we know that in Nigeria today and Africa in general, sickle cell has become a scourge, right? And it's affected relationships, impaired productivity, able to us. And what are the opportunities that we can begin to look into to ensure that we eradicate this scourge or at least reduce the impacts of sickle cell value-driven healthcare economy. And our mission is to help to reduce the incidence of non-communicable diseases by also helping to improve the quality of life of all citizens. So in terms of the products that we offer, we don't just depend on those products to help to improve the quality of life. We also believe that information, education, awareness is also an important part of improving the quality of life, because gone are the days whereby what you don't know can't kill you, but these days what you don't know will kill you, and you don't know that is killing you until you're dead. So I think it's important that these kinds of discussions spearheaded pharmaceuticals are important to have. And I'd just like to say again, thank you here, or people whose guests are not here, you can also share the recording with them. But of course, it will not be like being there live. So it's important that our friends and colleagues or people that you think would benefit from this. I think that sickle cell is a scourge that can be avoided, can be prevented, can be managed. A lot of people are living with sickle cell. A lot of very famous people are living with sickle cell these days, and they are getting good treatment. So I feel like we have some solutions that can help, and there are some information that we might need to also be abreast of. So that's the purpose of having this webinar. And I say once again, welcome to everyone. And I wish us a very engaging, informative, and hopefully life-changing session. So thank you very much for joining us. And I think we can get right into it. Thank you.
All right. So next on the agenda, obviously, is to do a brief introduction by means of a citation of our speaker today. So, ladies and gentlemen, our speaker today is Dr. Morufat OGUNDEYI. So she is a chief consultant pediatrician currently at the Federal Medical Center, FMC Abeokuta, Nigeria, with nearly 2 decades of experience in preventive, promotive, and curative child healthcare. She obtained her MBCHP degree from Olabisi Onabanjo University, formerly Ogun State University, Agowoye, and completed her postgraduate residency training in pediatrics, also at the same institution, where she qualified as a consultant pediatrician. Dr. Ogundeyi also holds a Master of Public Health degree and has additional professional certification in leadership and management in health, project management in global health, and postgraduate diploma in pediatric nutrition. She is currently pursuing a PhD in pediatric hematology at Ekiti State University, with research focused on the relationship between micronutrient status, disease severity, hematological profile, nutritional status, and pubertal development among children with and without sickle cell disease. Her clinical and academic interests are in pediatric hematology and oncology, particularly the management of sickle cell disease and childhood cancers. She established a pediatric hematology/oncology unit at FMC Abeokuta and currently serves as the head of same unit. She also coordinates pediatric palliative care, HIV/AIDS, and childhood tuberculosis services within the institution, where she has demonstrated proficiency and adeptness. In addition to her clinical responsibilities, Dr. Ogundeyi is an associate lecturer and visiting consultant at Olabisi Onabanjo University in Shagamu. She is actively engaged in clinical research, community health outreach programs, and capacity building in infants and young child nutrition, breastfeeding, and primary healthcare services. She currently also serves as the secretary of the Nigerian Society of Pediatric Oncology, ISPO. She has authored numerous publications in both local and international peer-reviewed journals. So, distinguished ladies and gentlemen, please join me in warmly welcoming the enigmatic, highly respected, and accomplished Dr. Morufat Mojisola Ogundeyi. Thank you very much. You have the floor, ma'am. Would you like me to share for you, or you rather share, ma'am?
You can, if you grant me the to share, I can share.
Okay. You can go ahead and share, ma'am.
Thank you very much. Good morning, everybody, once again. The topic that we want to address this morning is addressing the eating deficiency, why selenium supplementation should be standard of care for sickle cell patients in Nigeria. And my name is Dr. Ogundeyi Morufat Mojisola. I declare no conflict of interest in this presentation as I do not work for Oakleaf Pharmaceutical. What are the objectives of this discourse this morning? Is to explain the biological role of selenium and its importance in human health, understanding the relationship between selenium deficiency and sickle cell disease complications, discuss the clinical benefits, and advocate and develop practical approach for possibly incorporating selenium supplementation into routine sickle cell disease care in Nigeria. And I'll be following this outline that I've just projected. We are going to talk briefly about the burden of sickle cell disease, the nutrition in sickle cell disease and the hidden hunger, the overview of selenium, evidence linking selenium deficiency to disease severity, clinical benefits of this supplementation, and I will be concluding. As a form of introduction, sickle cell disease, as we all know, is a group of inherited hemoglobin disorder, and is the most common single genetic disorder globally. And this also could be a life-threatening disorder, especially in those people from the African ancestry, that is those of us from sub-Saharan Africa. It's registered as an autosomal recessive disorder, and there are many forms of this sickle cell disorder. The sickle cell disease is like an umbrella name, but when we have an homozygous inheritance, that is when both parents are hemoglobin AS, or the child will have the homozygous inheritance, referred to as sickle cell anemia. And there are also other forms of sickle cell disorder, the heterozygous form, the hemoglobin S with hemoglobin C, hemoglobin S with hemoglobin beta thalassemia, and the rest. As of 2009, the World Health Organization and United Nations, they've declared sickle cell disease as a global health problem with major public health significance. And there are so many things that make them to declare it as a public health significance. Because one, about 5% of the world population are carrier of sickle cell disease. And annually, about 2 to 3% of children are born worldwide with this disorder, which translates to around 300 children. And this is expected to increase to more than 500,000 by the year 2050. 75% of this sickle cell disorder, they live in low and middle income countries, mainly Nigeria, India, and Democratic Republic of Congo, with Nigeria accounting for almost half of the annual births of sickle cell disease globally. Nigeria has the highest burden of this sickle cell disease throughout the world. Why is sickle cell disease important? In sickle cell disease, the problem is a point mutation. It's just a single mutation at the hemoglobin, the beta hemoglobin of the beta hemoglobin change. And because of this point in the mutation, so many clinical manifestations and other problems do set in. This hemoglobin S, in the presence of low oxygen, become deformed. They form polymer, refers to as polymerization, and on account of this, these children or the individual could present with acute crisis, such as recurrent painful episodes, which is the most commonest one that is being recognized. In the West African, like of Nigeria, like this, for example, we refer to it as sickle cell disease as Aisan because of the painful episodes that these children do present with. Other acute crises that they could also present with include recurrent anemia that may necessitate recurrent transfusion. They could also have life-threatening condition like stroke. They could have sequestration, which if care is not taken, the child could die. They are also prone to infections. They are also at risk of high multi-organ damages. They are at risk of pulmonary hypertension. They are at risk of endocrine disorder. And they are at risk of chronic kidney disease, bone infections, chronic osteomyelitis, acute avascular necrosis of the hip, and so many other complications that will also impact on their life, and they are also at risk of early death. And it's been said that sickle cell disease contributes to about 5% of under 5 mortality. That most of these children in this environment, because even they present very late to the facilities, they die even before the diagnosis is made, and that most of these children we're losing them in the community. And some of them, even by the time they get to the facility, because of the cost of care and all the rest, they may not be able to sustain the care, and the child may eventually die. So apart from all other common childhood illnesses that contribute to mortality in this environment, sickle cell disease have been known also to be a significant contributor to mortality. This disease is a chronic disease. And because of this, it's not only affects the children, the children are prone to malnutrition, macronutrient deficiencies, they have delayed puberty, poor health-related course of life. And even on the long time, some of them are unable to work because of their disease condition, or some of them, when they are employed, they are not being given the job that's commensurate with their capability. So so it reduces the quality of their life. This disease also impacts not only on the children and the individual, it also impacts on the caregivers and family. And so many studies have also established it. OGUNDEYI et al. In the study in 2020 found out that more than 34% of the caregivers and family have a negative, the sickle cell have a negative impact on their quality of life. And so this disease also puts a lot of strain on the healthcare services in the country. Most of the health facility in our country, especially the pediatric facility, the pediatric care, you will see that most of the time, almost 1/3 to the half of the patients that are on admission in the children emergency or the pediatric emergency are admitted as a case of sickle cell crisis or complications arising from sickle cell disease. Hence, when this sickle cell disease remain undetected, individuals are likely going to face worsening health outcomes that are otherwise preventable with low-cost treatment. Like I mentioned earlier, the health, physical, psychological, and social burden of sickle cell disease are quite enormous. Anemia is a common clinical symptom, and many children are even transfused even before the hemoglobin phenotype is done. They just come, they get to the hospital, this child is anemic, and they need blood transfusion, and they won't screen them, they will just go ahead and transfuse, and they will just be coming with recurrent anemia. And I've mentioned failure to growth, failure to thrive and suboptimal growth, developmental delay, stigmatization. Cost of care is quite huge, especially in a developed country like Nigeria. And so this disease can predisposes the parents and the caregiver to poverty, poor health seeking, and some of the contributing factor is also because of poverty. They know that these children are sick, but because of poverty, they do not present at the health facility on time. Illiteracy too, they don't know. They just tell them it is abiku. This woman is always having abiku, and some of these mothers, their spouses may even leave them. In our family, we don't have abiku. This abiku is from your side. They forgot that for a child to have a sickle cell disease, both the father and the mother will have contributed to the inheritance. And then we also have poor seeking health behavior in our environment. We always go round seeking alternative solution before presenting at the health facility. In the recent past, in the last 2-3 years, in the last 2-3 decades, there has been great advances in the medical technologies and management strategy of sickle cell disease. And so most of our individuals with sickle cell disease are now surviving to the old age. They are surviving with old age. Yes, we want them to survive with old age. We also want them to have a very good quality of life. Mobility and mortality in low income and in low middle income country is still very high. In advanced country, there is facility for bone marrow transplants. There is facility for other disease-modifying drugs that are not yet available. For some of them that are even available in our countries, they are out of reach for most of the parents and the caregiver in our environment. So therefore, recognizing these challenges and specifically formulating targeted strategies to prevent some of these complications could go a long way in dealing with sickle cell disease burden, especially in low and middle income countries like Nigeria, Nigeria that has highest burden of this disease, so that we look at some strategies that are not too expensive, that are affordable, that are available, that are easily accessible, that can improve the quality of life of this individual with sickle cell disease. I'm going to talk briefly about nutrition in the sickle cell disease before we get into the selenium properly. Nutrition is one of the most important but often forgotten aspects of the care of patients with chronic disorders, such as sickle cell disease. There are so many emerging literatures, there are so many emerging concerns in literatures on the increased nutritional needs of sickle cell individual, and the proposed mechanism of suboptimal nutrition in this individual include increased metabolic needs and demands by these children. They have high hypermetabolism of the protein. There is chronic inflammation and hemolysis in them. There is increased erythropoiesis as a result of the recurrent and chronic hemolysis they undergo every time. Oxidative stress and increase because they are also prone to infection. So all of this one increases their metabolic needs, and so they are prone to suboptimal nutrition. Their dietary intake too may also be reduced, especially when they are having recurrent crisis. So because of there is release of interleukin-6, and this interleukin-6 reduces appetite in them. Increased energy demand also occurs in individuals with sickle cell disease, and they also have increased energy expenditure, and this also prone them to poor growth and delay puberty when compared to non-sickle cell individual. So the mechanism that increases the risk of malnutrition include protein internally malnutrition, the micronutrient deficiencies, immune function impairment that they have, poor bone health, growth retardation, and consequently they have delayed puberty. Micronutrients, they are vitamins and minerals that are required in small quantity, and they are quite very essential and important. They are needed for growth, they are needed for development, metabolism, immune function, and overall health, not only in sickle cell individuals, but in the general population. But sickle cell individuals now need these more micronutrients more than the general population. And there are several macronutrients that are crucial for optimal.
No
Sorry,
problem. Yeah, we can see your screen now. You're welcome.
Yes, I was logged out, so I have to change my network. I'm sorry about that.
No problem.
I was about talking about micronutrients requirements in children, and I mentioned that micronutrients are vitamins and minerals that are required in small quantities by the body, and they are essential for growth, development, immune function, metabolism, and overall health. Not only for individuals with sickle cell disease, but for the general population. But the sickle cell disease individual actually require more micronutrients than the general population on the account of what I mentioned earlier. And I said that there are so many micronutrients that are crucial for optimal health in children with sickle cell disease, and some of them include iron, folic acid, and the vitamin B6 and B12 that are required for the red blood cell formation, vitamin D, calcium, and zinc that are required for growth and bone mineralization, selenium, vitamin A, C, and E that are an antioxidant, and likewise magnesium and copper that are needed, they are electrolytes and minerals. So when there is deficiencies deficiencies can result in significant clinical and public health consequences, especially among children with sickle cell diseases. They have a good nutrition in sickle cell disease. It supports the high energy need requirements by these children. It reduces painful vaso-occlusive crisis, hospitalizations, and it also strengthens their immunity. It promotes healthy growth and reduces risk of complications that are more common in individuals with sickle cell disease. And it's also helped to maintain the red blood cell integrity. Eating hunger. What is eating hunger? Eating hunger is deficiencies of micronutrients without signs and symptoms of micronutrient deficiencies. They are there, but the signs and symptoms, the clinical signs and symptoms may not be so obvious initially until when long-term complications have set in. So the mechanism of micronutrient deficiencies, otherwise referred to as eating hunger in sickle cell, are poorly as initially highlighted. So the mechanism include this hidden organ, the micronutrient deficiencies in sickle cell disease. It's not only because of the diet, it's not only because of poor diet. It is so the reasons are so many. They are multifactorial. It could be disease driven, and because of this chronic hemolysis and all the other disease entity that they have, it is also a continuous process in them, unlike normal population who do not have all these chronic hemolysis and other problem. Pain or vaso-occlusive events increase the probability of developing this hidden organ. Because during painful episodes, there is reduced dietary intake in them, there is reduced nutrient absorption, likewise it reduced nutrient utilization. There is also increased degradation and losses of these nutrients during this painful episode. There is increased basal metabolic rate, and which also alter the metabolic pathways in them. And also there's increased nutrient loss with associated with, and also there's increased growth requirement, especially in growing disease. So all this mechanism increases the risk of developing this hidden organ. Because of the chronic hemolysis that they have, there is loss of zinc from red blood cells, which is one of the critical micronutrients that is required by sickle cell disease to maintain optimal health. Sickle cell disease individual also have what we call hypostenuria. And what is this hypostenuria? There is excessive passage of diluted urine because they are unable to concentrate urine. And there is also abnormal tubular reabsorption of this urine. And also this one causes defective zinc homeostasis in them. So they are losing a lot of zinc and some other micronutrients into the urine. Oxidative stress that they undergo daily basis increases metabolic selenium deficiency. Recurrent infections will also lead to because of they have suboptimal immunity. Their reticuloendothelial system is already impaired, so it's unable to perform the functions. They are prone to more infection, and with this more recurrent infection, they are also prone to lose most of this micronutrient deficiency, and they are unable to eat, increase metabolic demands, and reduce utilization. What are now the consequences of these micronutrient deficiencies? It can lead to hematological, skeletal, oxidative, and endocrine dysfunction. Micronutrient deficiencies can prone them to stunted growth and or growth faltering. They may be growing initially. When we look at the growth pattern, it may be normal initially, but later on with increased deficiencies they have, their growth starts faltering. And some of these micronutrient deficiency that have been attributed to cause growth faltering include zinc, selenium, the vitamin A, C, and E. They also have failure to thrive. And some of them, when you look at them, their weight, their height, and their stature may not be at par with their age and sex match non-sickle cell individual. The micronutrient deficiency could also cause neurocognitive impairment. For example, it has been well established with the deficiency of vitamin B12, there could be neurocognitive impairment. There is reduced bone density and impaired skeletal maturation when there is deficiency of vitamin D, vitamin C, and magnesium. And we should not forget that they have chronic hemolysis, there is increased erythropoiesis, so there is increased demand on the bone function. And when there is this deficiency, deficiency of some of these micronutrients, it could also impair the skeletal maturation in them. They could also have delayed puberty and sexual maturation with deficiency of some of these micronutrient deficiency. And it has been established that for those that are deficient in zinc, they are at they have more the rate at which they have vaso-occlusive crisis and severity of vaso-occlusive crisis is quite much in them, as established by Temiye et al. And in the Lagos State University. They also have micronutrient deficiency, also prone them to poor health-related quality of life. So selenium is an essential trace element as the body is unable to synthesize these micronutrients. Some of these micronutrients, our body may be able to synthesize in a very minute amount, but it's not going to meet our daily demand. But the selenium, our body is unable to synthesize selenium. So that means we have to get this selenium from our food sources, such as fish, seafood, meat, egg, dairy products, cereal, and nuts. But the selenium content in all this food is also largely dependent on soil selenium concentration. And in an areas where there's a lot of flood, where there's a lot of erosion and all the rest, the selenium content in this soil may be quite low. And even though we may get some of these things, it may not be able to meet the daily requirements. For the child, it may not be able to meet the individual daily requirements. This selenium, it has a diverse physiologic functions and is very crucial for human health. It is a key component of various enzymes and protein, and it is exert in the form of selenoprotein. In children, the daily requirements, I mentioned earlier that micronutrient deficiency, they are needed in a very minute quantity. So the daily dietary requirement in children is between 15 to 55 microgram, whereas in adult for a man is about 40 microgram, while in women is about 30 microgram that is needed to maintain optimal health. Like I mentioned earlier, that is an essential trace element. It is required in so many physiological processes in the body. It is an antioxidant. It is a core enzyme in the glutathione peroxidase, which is a key antioxidant in the body. This antioxidant neutralizes free radicals such as hydrogen peroxide. It also prevents cellular tissues and lipid from the oxidative damage, and also protect the red cells. I said earlier that the red cell membrane integrity is reduced, especially when they have polymerization, and it's one of the causes of the chronic hemolysis in them. So we need something to protect the red cell membrane integrity. The selenium is also needed in immune system regulation. It acts by supporting proliferation and activation of the immune system, and it also modulates inflammatory processes. For example, the T cell functions and natural T cell killer cells activity are enhanced by selenium in the body. Selenium contains iodine, iodothyronine deiodinases, and which is required for the synthesis and regulation of active thyroid hormone. Thyroid hormone the functions of thyroid hormone are so many. They require in metabolism and in growth. So if selenium is deficient, it's going to impair the growth of that individual, and the metabolism is also going to be affected. Selenium is also required for normal sperm motility and development. So it's crucial, it play a very crucial role in healthy pregnancy outcomes for an in adult too. It's also play a crucial role in the quality of the sperm produced by the adults. The selenium also also function on the has a function on the cardiovascular. It has a cardiovascular and neurological protective mechanism due to its anti-inflammatory and antioxidant effect of this selenium protein. It lowers the blood pressure, and it also improves the cognitive capability of the individual. What is the impact of selenium? The pathophysiology of selenium, the figure I showed on the right side, shows that by the time the dietary selenium that is we got from the fish, the nuts, egg, dairy, and all the rest, when it is absorbed, it's in sickle cell disease. One of the major problems they have is recurrent vaso-occlusive crisis, recurrent hemolysis, chronic hemolysis. And this chronic hemolysis, they are due to excessive production of reactive oxygen species. And this, when there is production of this excessive reactive oxygen species, it leads to, and this causes intracellular hypoxia and leads to oxidative stress. And when there is oxidative stress, it leads to the breaking down or worsening the hemolysis that they have, and it also worsens the vaso-occlusive effects that they have, and thereby causes damage of the membrane, the lipids in the membrane, and also endothelial injury, causes inflammation, and also allow the red cells to stick together in the endothelium, also worsening the hemolysis. And with the worsening of this hemolysis, so the red blood cell oxidative stress is now exacerbated if there is deficiencies of this glutathione peroxidase. And this glutathione peroxidase, like I mentioned earlier, is selenium dependent enzyme. So when the level of the selenium in the body is low, all these cascades become exaggerated, and with a worsening of the hemolysis, there is vascular endothelial damage, increased hemolysis. There is now they are more prone to it worsens the anemia, and it's also impaired the mitochondria. When there is selenium deficiency, it's also impaired the mitochondria functional abnormality as a result of hemoglobin S autooxidation. So because of the excessive generation of the reactive oxygen species. What are the challenges in identifying micronutrient deficiencies in our environment? There are many factors that predisposes the sickle cell individuals to micronutrient deficiencies. Some of them I've mentioned them earlier: high infection burden, nutritional challenges, food insecurity in our country, poverty. Most people are even unable to afford some of these basic things that can provide them with with the diet that can make them have adequate micronutrients in their diet. Inadequate knowledge. Some have the money, but the way they prepare this food is inadequate. And poor dietary diversity, especially in our environment. Either we eat eba in the morning, we eat rice, then in the evening we take garri with the fish. And with this economic now, with the poverty that is now ongoing, so most parents are unable to even afford some of this food that may supply these children with the micronutrients that they will require. There is also high prevalence of malnutrition in our environment and eating organ, which is now further worsens by sickle cell disease. There is also limited access to advanced therapy, such as disease-modifying drugs. Commonest drug in our environment that is being used for as a disease-modifying drug, some of these parents are unable to afford them, and even the advanced one, we can't even afford them. Most parents, there is limited access to automated exchange blood transfusion. The cost of automated exchange blood transfusion runs into millions of naira, which almost all the parents are unable to afford. Stem cell transplantation, gene therapy, they are available in advanced country, and it's one of the reasons that the outcome in them is quite better than our environment, but is still inaccessible in our environment. There is no the though in the recent time we now have a national guideline on sickle cell disease, which mainly focuses on adults, with leaving just giving a small portion to the to children. And in this national guideline, little is mentioned about micronutrient deficiency in the management of sickle cell individual. And even for where the national guideline is available, there is weak integration or screening in routine sickle cell disease care of for micronutrient deficiency. And why is there a weak screening for this micronutrient deficiency? One, lack of equipment and personnel to carry out these investigations in most facilities. This investigation can only be done in most of the time in the tertiary institution. And the cost of access of these micronutrients, they are quite expensive and are out of the most reach of the most caregivers and individuals with sickle cell disease. There is also disease-related diagnosis complexity and late presentations because of the poor awareness of micronutrient deficiency among the sickle cell disease among the healthcare workers. Even when they present to some of these health facilities, they are not being screened for these micronutrient deficiencies. What are the clinical benefits of selenium? One, it helps in reducing oxidative stress, and when the oxidative stress is reduced, it reduces hemolysis, thereby improve erythrocyte survival with fewer disease complications. It enhances the stabilization of erythrocyte membrane, thereby improving the red blood cell integrity and reduces red blood cell destruction, which when there is reduced red blood cell destruction, that this red blood cell are surviving, they are surviving better, they are able to, it enhances oxygen delivery. It boosts antioxidant defenses and also reduces oxidative damages, thereby improving endothelial function. It attenuates vascular inflammation and also reduces vaso-occlusive frequencies and severity. It also reduces the frequency of infections and enhances the T cell proliferation, so thereby able to enhance the response to vaccination and reduces infection rates that could be life-threatening, especially in children with sickle cell disease. It also improves growth and nutritional status by enhancing the thyroid metabolism. It also reduces the endothelial dysfunction. It improves it, it reduces endothelial dysfunction, improve nitric oxide bioavailability, and also curb vascular inflammation, thereby reducing the long-term organ damage and life-threatening complications like a stroke, pulmonary hypertension, and acute chest syndrome. And also on the long term, it improves the health-related quality of life. What are the practical approaches that we can incorporate, that we can use to incorporate selenium supplementation into our routine sickle cell disease care? One, we should start with the incorporation of nutritional counseling into routine sickle cell disease clinic. I think it is a high time now that nutritional counseling the dietitian should be part of the routine sickle cell disease clinic and be part of the team, so that when the parents come, the individual with sickle cell disease come, this nutritional counseling can be emphasized all the time. We should encourage consumption of selenium-rich foods. Animal sources that is rich in selenium include fish, tuna, egg, and chicken. Plant sources like beans, groundnuts, soy products, and whole grain, we will also encourage them to take it. Then we need to also continue comprehensive sickle cell disease assessment to include screening for micronutrient deficiencies. So, and this is to identify these micronutrient deficiencies on time to minimize disease severity, reduces disease crisis, minimize improve their growth and sexual maturation. We should also integrate selenium into the existing sickle cell disease clinic medication. Nutrition, when we do the nutritional assessment, growth assessment, micronutrient deficiencies assay, and once any of them we have any deficiencies of any of these micronutrient deficiency, we should start and treat them on time. We need to train healthcare worker to recognize all this hidden hunger, and properly also develop supplementation protocol and the way of monitoring these children for the micronutrient deficiency. And we also should encourage the incorporation of not only the selenium but all the other micronutrients into the National Sickle Cell Disease guideline. Selenium supplementation. I said in sickle cell disease, the selenium supplement, in case the patient is unable to get from the food sources and both the animal and the plant sources, we can get it with the supplement, maybe the one that has been produced. Selenium supplement is affordable and is readily available in Nigeria. It is easy to administer. It's not bitter. It has a wide safety margin when properly dosed. When properly dosed, this is very important. We should not say that it's okay. Yes, these children have micronutrient deficiency. Let me give them supplements like 10 times in a day, or 3, 4, or 5 times in a day. It should be used as prescribed by the healthcare worker. It has also a public health significance because of the so many functions that it performs. Selenium supplementation also meets criteria for routine implementation, as it is also part of a key micronutrients or the hidden organs that are micronutrients that are required by children with sickle cell disease. However, selenium supplementation should complement, but not to replace, folic acid supplementation, nutritional support, vaccination, drug disease modifying drug, penicillin prophylaxis, and regular follow-up for children with sickle cell disease. As a form of conclusion, hidden organs are modifiable, and they are frequently overlooked contributor to morbidity among sickle cell disease individuals, which is a great challenge and remains a challenge in low and middle income countries. Selenium supplementation is biologically plausible, clinically beneficial, inexpensive, generally and highly feasible within Nigerian healthcare setting. Given its role in combating oxidative stress, supporting immune function, preserving red cell integrity, and potentially reducing disease severity, selenium supplementation should be considered an essential component of comprehensive, evidence-informed sickle cell care in Nigeria. These are some of my references. Thank you to all the healthcare professionals. Thank you to the parents, to the individual with sickle cell disease that are on this platform.
Thank you very much, Dr.
Thank you, Doc. Thank you.
Really appreciate this wonderful presentation and your submission as well. Well delivered. And I believe everybody present that listened to the presentation have one or two takeaways. Particularly for me, one of the most interesting facts that I talked about is the burden of sickle cell disease in Nigeria. A number of us were probably oblivious to the fact that so many people are actually living with sickle cell disease. And in terms of the projection as well, it's not looking good at all. And one of the core duties and core reasons why we at Oakleaf Pharmaceuticals do what we do is to ensure we bring solutions, to improve the quality of life of every patient. And, talking about the core focus for today's webinar, the sickle cell patients, we want to improve their quality of life and the quality of life of their caregivers as well, because once our children and everybody living with sickle cell disease are able to have a better quality of life, we will also impact positively on the lives of friends, relatives, and us as healthcare professionals that treat them. In the sense that we'll be able to be more productive in other areas by ensuring we improve their well-being essentially. Okay, so that's essentially what we are here to do as well. And at Oakleaf Pharmaceuticals, that is our mission, really. We want to improve, we want to prevent the incidence of communicable diseases, and sickle cell is one of them. So our solution to address this actually is that one that is quite popular, as a matter of fact. It is a solution that has been in the Nigerian industry for quite a while, which is immune active. Okay, so I'm briefly going to just talk about immune active briefly, and I will hamper more a lot on the solution that immune active gives on into the care of sickle cell patients currently in Nigeria, and essentially why you should include Immunactive as a routine medication for your patients, generally, particularly also in sickle cell patients, patients living with sickle cell, essentially. So Immunactive is a premium formulation, a premium supplement formulation from Oakleaf Vitamins, and contains high strength vitamin C with zinc and selenium. If you recall, during Dr. Ogundeyi's presentation, she basically hampered on the benefits of micronutrients and vitamins in essentially in preventing breakdown, routine breakdown in sickle cell patients. Okay, so and during the course of this presentation, I'm going to briefly highlight some other key benefits that Immunactive gives you and your patients. Okay, so obviously, why daily immune support matters. Dr. Gday has mentioned this earlier. Why do we advocate for daily supplementation? Why do we advocate for people to take supplements? Why do we preach that? Okay, so a lot of common immune challenges are well known. Talking about recurring cold, flu, respiratory infections, a lot of people come down with cold, especially in this weather. We're going into the rainy season, or we're already in the rainy season. So, the seasonal incidence is always high for community acquired respiratory infections and cough and cold. So it's best to always arm yourself. Well, ensure that your immunity is at optimum at its best. For fatigue, oxidative stress, and burnout, particularly in patients with sickle cell disease, we see this over and over again. They are prone to fatigue, they are prone to oxidative stress, and easily they get burnout as well. And this can lead to a lot of painful episodes and also sickle cell crisis, what we call sickle cell crisis. Then patients with that have undergone any form of surgical procedure, and patients that just recovering from any form of illness, we always ensure that in terms of immune support, they take supplementation, nutritional depletion as well. I mean, it goes without saying the fact that in terms of our nutrition currently in this country, it's a bit inadequate, to ensure there is adequate nutrition in terms of the micronutrients. So our meal sometimes due to overcooking, due to our meal choices, which may not be adequate, it's best to always take supplements to support whatever meal we're taking. The sickle cell disease is a pro-oxidant burden. This was evident in across the slide of Dr. OGUNDEYI in terms of oxidative stress. The cells, the red blood cells, the white blood, every cell in the body is subjected to oxidative stress, especially in sickle cell patients that already have some form of inadequacy in their red blood cells. Okay, so any medication or any supplement or brand that can help prevent any form of oxidative stress will be beneficial for them. Okay, so what does immune active contain? Like I mentioned, it contains 1,000 milligram vitamin C. Okay, and that actually helps in terms of boosting immunity, activates the neutrophils, the white blood cells, and ensuring reduction in infection severity as well. Then it also contains zinc. Okay, so zinc actually supports T-cell maturation and also an antiviral defense, which is a lot of times implicated in most upper respiratory tract, infections, and also supports wound healing. Then we talk about selenium. So immune active contains 100 micrograms of selenium. And a lot of emphasis has been made about the benefit of selenium in sickle cell patients. And immune active is a top quality premium brand that actually can give these categories of patients that supplementation that they need in terms of selenium, which actually gives them that benefit of that triple action coverage of activation, of protection, and also ensuring they perform at their optimum best. So these are three very important micronutrients um, that immune active contains. Okay, so they are also at clinically relevant doses of pharmaceutical grade. So talking about pharmaceutical grade, those are the purest forms of ingredients that you can find anywhere in the world, and they're manufactured they are manufactured in Europe, so they are manufactured at GMP certified, manufacturing sites. So you are getting the best quality of brand of supplement brand at very affordable prices as well. Okay, like I've said, contains 1,000 milligram of vitamin C, 15 milligrams of zinc, and 100 microgram of selenium. And for these categories of patients in sickle cell, like I've said, the selenium in that actually has a lot of benefits, a lot of which has been, detailed by our keynote speaker. So it improves sickle cell disease clinical status, and a lot of research, points to that as well. Okay, it supports immune modulation and also powers antioxidant enzymes. So oxidative stress is something that we need to always ensure we prevent in patients with sickle cell disease. Okay, so in addition to that, for everyday protection as well, for everybody, even if you are a fitness and wellness enthusiast, immune active actually helps in immune defense. We've talked about that as well. It boosts your energy and vitality. It also helps in skin and recovery. So it supports collagen production. So when you take immune active, your skin will be glowing, and also it supports wound healing and skin integrity as well. It also helps in healthy aging. Okay, so as we get old, the body's ability to actually absorb lots of nutrients dwindles, and that's why we also advocate for supplementation. So with all of those, healthy aging is guaranteed with immune active. It limits oxidative stress, which actually promotes aging, and also helps to sustain cellular protection over time. Now, in terms of convalescence, basically for those recovering from any form of illness or medical treatment or surgical procedure, it is advised that they take supplements as well to help speed up recovery from illnesses. And immune active is also a guaranteed source of anti-inflammatory support. So the key constituents, the three powerful ingredients immune active actually helps to reduce any form of inflammatory cell burden. And like we've said, with times without number, selenium actually also supports sickle cell disease patients by reducing the hemolytic process. All right. So the preaching, what we are trying to say essentially is that for patients, for this category of patients, we should integrate immune active as part of their routine, treatment, routine regimen when they come to our clinic when we want to, start their therapy. All right. So these are the ideal patient profiles, essentially the people that we advocate can take immune active. Okay. So the elderly or middle-aged, people with weakened immunity, busy professionals as well. You go out daily, you encounter all sorts of, stressful situations and also oxidative situations as well. Students with fatigue as well, patients under stress or burnout, post-surgery or post-illness recovery, athletes, smokers and alcohol consumers. These are pro-oxidant constituents, really. And the more you protect yourself, your body, your organs against oxidative stress, the better for you. And also definitely people living with sickle cell disease. So we keep preaching this as well. And why do we say you should, choose immune active? Number one, like I mentioned earlier, pharmaceutical grade ingredients. Immune active is formulated using the highest quality ingredients and processes. Immune active is a trusted brand, and it became very popular during the COVID-19 era when people needed something to protect themselves. And immune active was something that actually a lot of people used to protect themselves against the infection by COVID-19 or to reduce the severity of the disease there. So if you was trusted then, we also preach that, the trust is always there, it's retained. So a lot of people should tap into that. So it is high potency and also safe for daily consumption, daily immune support. It is balanced, it contains balanced and clinically relevant doses. In terms of quality, it's manufactured at a GMP qualified manufacturer. Premium excipients contains premium excipients with better tolerability and absorption. And the consistency, and it is consistent and reliable compared to most of the other brand. Okay, so immune active, what's the dosage? It's just 1 tablet daily. So we have the 30 tablets variant and also the 100 tablet variant. So the 100 tablet variant is value for money because you get that for 3 months supply for less than 20,000 from us anyway. For less than 20,000, you get a brand that you can use for over 3 months, really. And what we usually preach is between 8 to 12 weeks of daily use for full immune coverage, for full benefit, clinical benefit. So for you can get the by 100 or you request for it from our website and we supply you, or you contact any of our reps with wherever you are. It can be used daily as preventive, supplements for year-round immune support, episodically also during illness recovery. Okay, then it can also be used alongside antibiotics for chronic illness management. It is gentle on the stomach, it is sugar-free, so for people that are diabetic and will need something that wouldn't spike their sugar. Immune active sugar-free. It's also sodium-free, so it can be used by both diabetic or hypertensive patients. It is non-drowsy. It is 100% vegan as well. Contains plant-derived ingredients and also has minimal side effects when taken as directed. So at this point, the what we are preaching is immune active is your go-to for anybody that requires a premium supplement brand to help in terms of boosting immunity, improving quality of life in sickle cell patients, and also, a year all-round protection against, community-acquired infections. So for our dear prestigious physicians who want you to prescribe and recommend immune active for your patients, and also for our esteemed pharmacists, you need to make immune active the first option you recommend to identify patients. So for your sickle cell patients, make immune active a go-to recommended supplement brand for them for daily immunity. And also for our caregivers, Also ensure you take immunity daily to prevent any form of stress for yourself and also improve your immunity. So we are always available for you. Contact us, go to our website, contact our reps. So that's the number there for you to call. In addition to all of this, we also, like I said, Oakleaf vitamins, we have lots of premium brands that you can rely on, to get the full benefits, the full complement of protection, really. So we have Minadex range of multivitamins as well. We have the popular Cargovit. We have vitamin D3K2. We talked about this during the last webinar. This is immunactive. I'm sure we are all familiar with Cargovit, vitamin C and calcium. We have the Minadex gummies, also comes in chewable gummies. So we are currently running a promotion on this at the moment. Buy one, get one free. And for kids as well, we have the multivitamin kids, which comes in drop formats, which is easily administered for kids. We have the D3 spray. You just spray and go for your kids as well for supplementation. The immune defense, which is very, very well formulated to ensure total coverage for kids. All right, then serine capsules, basically formulated to ensure the body is able to withstand any form of stressful situation. It helps the body to relax and calm down and ensure you have a very good sleep quality. Then there's Good Seed Fertility for Men, Good Seed Fertility for Women, aptly named, essentially Safe Preg, and our Platinum series containing magnesium, maca roots, zinc, and so many. Then we have our probiotic. So these are all, essentially very premium, like I've said, premium quality, medications that we want you to take advantage of. Okay. So on behalf of everybody, on behalf of the staff and management of Oakleaf Vitamins, I'd like to say thank you once again for everybody. So we've come to the end of all the presentations, and if